I think the thing that was really intriguing in terms of the workflow enhancement was knowing that behavioral health is frequently, and there's different kinds of interventions, of course, is a human to human sort of intervention experience, right? Not to say that a lot of healthcare isn't, but particularly important, right? Behavioral health. That for years we've been using EHRs and pretending like they're going to make our lives better, and they have made some things better, and in other cases it feels like empty promises. And at some level, like, we've resorted to tactics like concurrent documentation, right, where I'm sitting and staring at a computer and I'm sort of going back and forth between the human and the computer in order to be as efficient as I can with the requirements of documentation, right? Because I can't remember all the things. There's a lot of checkboxes, a lot of questions, a lot of narrative to capture, a lot of things to assess, like risk and other stuff to do my job well. Concurrent documentation was one solution to also try to be as fast as possible, right? Like, by the end of the day, I don't have to do a bunch of notes or spend into my evening time writing a bunch of documentation. And so of the AI tools out there related to documentation, I know that this platform does more than that, but I'll just focus on that. The thing that I like the most is that it actually allows for folks to be able to give up some of that concurrent documentation and be really, really present with the human in the room, which is, of course, the fundamentals of what we're doing as behavioral health providers. Now, that's a shift because we've been doing this concurrent documentation thing for a long time, right, to gain those efficiencies. But now that we have tools like this that allow us to bring that human piece back, folks, like, the tool is capturing some of those details, and not just it's doing a lot of other things, but one of the things is it's allowing us to be present, and those details can then be pulled into the documentation without me having to make sure that I'm scribbling down every little. Of course, I don't know how many people are scribbling down, right? Typing away is really what I meant to say. Typing away the details of the interaction. And so for me, that's a huge workflow win, because it doesn't just make things faster, it has the potential to actually improve the quality of the intervention, because I'm doing the intervention in a way that, that we sort of build our models around psychology to do.